Hi, I'm Brianna Hutchison, and today I'm doing the neuro checkoff. This is Alex Malberg. He is going to be my patient today. This is my room, and I am going to begin. I would first, by introducing myself, washing my hands, I would check my two patient identifiers by the MRN number and then the date of birth, and then I would provide privacy for my patient, and I would explain the procedure, and I would then assess my patient's medical history. So can you give me two examples of any pertinent medical history, such as experiencing seizures or any epilepsy?
Yes, I have experienced both.
Okay, so those are my two examples, and now I would be assessing my patient's cognitive function, and I would assess the orientation of person, place, time, event. Can you please tell me your name?
Alex Malberg,
And your date of birth?
11/15/99,
Do you know today's date?
August 5th, 2020.
And where are you?
I'm in the Kyler building of the College of Nursing.
And what are you here for?
A neuro exam.
So my patient is alert and oriented ×4. Now I am going to assess his mood, behavior. And how are you feeling today, Alex?
I'm doing okay, a little stressed.
And Alex's behavior matches his mood because he is fidgeting with his fingers and tapping his feet. And now I am going to assess my patient's thought processing, and by this I will ask him a question to distinguish something over another. Can you please tell me what the difference of a lake and an ocean is?
A lake is normally consumed of fresh water, and the ocean is consumed of salt water.
My patient has clear thought processing, and as I said earlier, my patient is oriented and his speech is clear and articulate. So now I'm going to assess my patient's Glasgow coma scale, and his eyes are rapidly spontaneous eye movement. So I would grade that as a +4, and then his verbal responses is a +6 because he is oriented and responding appropriately. And can you please squeeze my fingers? Alright, so I would grade that as a +6 because he obeyed the command, and I would grade the verbal response as a +5. Now I am going to assess the cranial nerves, and for this I am going to first assess the 3rd, 4th, and 6th cranial nerve. And the 3rd is the ocular motor, which is a motor and sensory nerve. And the 4th one is trochlear nerve. This is also a motor nerve. And the 6th one is going to be the abducens nerve. And by this, I will be demonstrating through the Perla test. So my first portion is I'm going to measure the pupils. And Alex's pupils are 4, equal, and round. Now I am going to assess the light reactivity. Can you please take off your glasses for me? So I noticed Alex's eyes constricted as I shown the light in the left eye, and vice versa with the right eye. And then now I am going to do the positions test. So if I may have you please look at the tip of the pen and only follow with your eyes and not your head. So Alex's eyes followed in a smooth, symmetric way. I did not notice any nystagmus. And the final portion of this Perla test is to test accommodation. So again, just follow the tip of the pen without moving your head. and that movement was smooth, and I noticed convergence. Now the next portion of this nerve testing is to test the facial nerve, which is the 7th nerve. And can you please put your mask down for a few seconds? Can you smile for me and frown? Puff out your cheeks. All right, Alex's facial movements were smooth and symmetric. And now the last cranial nerve I will test is the spinal accessory nerve, which is a motor nerve. And I am going to have you shrug up towards the sky, and then I am going to have you push your face into my hand. Okay. All right, so Alex's movements were strong, equal bilaterally. And for the next portion of this exam, I am going to have Alex put his finger on his nose, and then close your eyes and go faster each time you do it. Okay, you can open. Alex's movement was smooth and rapid. And now I am going to assess the upper extremities. And for this, I'm just going to look for any redness, swelling, and any pain. So is it okay if I palpate?
Yes.
All right. Do you feel any pain?
No.
Do you feel any pain?
No.
Okay. So Alex does have a little bit of redness on his arms with a beige color. And that redness is just the pink undertones or the red undertones of his skin. I do not notice any swelling, and he did not note any pain. Now I am going to have you squeeze my finger once again. Okay. The strength was equal and bilaterally. And now I am going to assess the lower extremities. And for this, I am going to assess again any redness, swelling, or pain. Do you feel any pain?
No.
Do you feel any pain?
No.
Do you experience any numbness or tingling?
No.
Alex has a beige skin color with pink undertones, but I do not know any redness that is associated with swelling. So now the next portion of this exam is to push up onto my hands and then push down. Okay, the strength was strong and equal bilaterally. Can you please take off your your shoe? Now I'm gonna apply my gloves. I would have applied my gloves to begin with. Now I am going to test the plantar reflex. And I see that Alex's plantar reflex for the Babinski sign is negative. So after I've assessed the lower extremities, I will have had to assess the cerebellar system, and I did the point test earlier too soon, so I will have Alex repeat that test. Can you please put your finger to your nose, close your eyes, alternate, and go faster? Okay, you can open. And as I said earlier, Alex's movement was smooth and rapid. And then now I am going to have Alex stand up to perform the Romberg test. For this section, you are going to be closing your eyes with your hands at your side. And for this, if you get dizzy, let me know. I'm standing right here. And for this, I would count for 20 seconds and assess any swaying or any dizziness. So you can open your eyes, and Alex minimized his swaying. And now I would assess his posture and his gait. And can you please walk to that dresser and back. Okay, Alex's posture is erect and upright, and his gait was smooth with his arms swaying in opposition. Now I would do my closing. I would lower the bed to the lowest position, put 2 side rails up. I would put the call light in reach and make sure my patient is comfortable, and then I would wash my hands and document my findings.